are 4 things I didn't recognize as perimenopause symptoms, but they were. The first one is going to be muscle weakness. I felt like walking upstairs was like pushing myself through cement, and I've always been an active and strong person, so this one was surprising. I remember when I was 44 going on a hike, and I was out hiked by a 70-year-old woman who just had a hip replacement. Like that was one of the first things that really clued me in that something was wrong. When my doctor sat me down and told me that I was dealing with exercise intolerance and I was also having issues with recovery and it was due to not having estrogen, I almost cried because of how hard I had been on myself for being weak. Estrogen has completely turned this around. I am now strength training. I am having muscle gains. I have more energy. I feel better at 46 than I did at 36. So there's that. The second thing would be body pain. Look up musculoskeletal syndrome of perimenopause or menopause. My hip felt like it had bursitis or tendonitis. It hurts. It was excruciating. And then my feet were cramping out of nowhere. So when you don't have the estrogen you need, our connective tissue goes from being soft and supple to sticky and thick. It literally doesn't do what it needs to do. So yeah, it's going to hurt. Estrogen is like made everything, it keeps everything flowing and going, and it is. And I am so, so grateful. The third thing would definitely be the sleep disruption. I didn't realize this was part of perimenopause because my life was legitimately stressful. So when I woke up thinking stressful things, I thought that was normal because I was just stressed out. Turns out I got my progesterone, 200 milligrams bioidentical micronized progesterone. I don't wake up. And if I do wake up, I feel calm and I go right back to sleep. That was life-changing. What else? Other things that I didn't personally have. I didn't really have mood changes. I did not have the itchy ears, although like maybe TMI, I had always had waxy ears and all of a sudden my ears were dry. And I think that's part of where the itchy ears comes from is just ears getting really dry. But when I started taking estrogen, I have an estradiol patch, my ears started producing all that wax again. But the reason I'm sharing this is because no matter what your symptoms are, you can get your blood labs done. You can get HRT. I think it's important that women talk about this so that the next generation behind us recognize symptoms, hopefully faster than I did. But I know the generation before me was mostly left to suffer with no treatment, having their frozen shoulder and their pain and their sleeplessness and feeling like they're going crazy and everything else. So explore your options and talk to somebody who specializes in menopause. And if they're telling you something and shutting you down, go talk to somebody else.